Welcome to the third and final day of the Future of the American Child journalism training, sponsored by National Press Foundation here in McAllen, Texas. My name is Rachel Jones, and I'm the Director of Journalism Initiatives for NPF. Before we get into today's activities, I want to take one more opportunity to thank our sponsors, the David and Lucille Packard Foundation, Heising Simons, and the W.K. Kellogg Foundation. We spent the past few days unpacking some of the foundational issues for children and families: healthcare access, education, early learning, mental health. These are all certainly important aspects that we as journalists need to understand if we want to provide contextual coverage of children. Today we're going to get into some of the harder, tougher challenges to take on, but the ones that are most critically important, that we provide accuracy and context when we talk about these issues. And the first of those is gun violence in children. We always know that the really extreme events and the terrible outcomes get the headlines. But as journalists, we want to be able to understand the data around these events, what it really tells us, and how we should be reporting on the potential solutions, et cetera. So we're joined today by Nirmita Panchal. She is a senior policy analyst for the Kaiser Family Foundation's program on the ACA and the program on Medicaid and the Uninsured. Her work focuses on research and data analysis for mental health and substance use. Again, her full bio is on our website at nationalpress.org, so please check that out. But Nirmita, I want to welcome you to our event this morning and thank you so much for taking time out to join the Future of the American Child journalist. And please take it away.
Great. Thank you so much for the introduction and for having me. We know, just as what we've seen in the news this week, that gun violence is a public health crisis affecting really all communities across the country. So I'm glad that I can be here today to share with you all a little bit of how, in particular, this is affecting children across the country. So I'm going to get started here and share my slides. So just give me 1 second. So in my presentation today, I am going to focus specifically on how gun violence affects children, and that is both through the harmful physical and mental health impacts. And as I go through the presentation, I think it would be helpful to start with giving an overview of the gun violence data analyses that we have published, and then focus on specific subpopulations, and then move on to mental health implications that stem from gun violence. So to start, I wanted to provide some background on the magnitude of this issue. In recent years, firearms have become the leading cause of death among youth in the US. So this means that today, more youth are dying by firearm than by motor vehicle accidents. And by 2021, 7 children per day were dying by firearm. And the extent of youth firearm deaths we are seeing is an issue that is unique to the US. So as you can see in this next slide, youth firearm death rates in the US are by far higher than our peer countries. In fact, firearm deaths account for 20% of all child deaths in the US. But if we look at our comparable countries, on average, firearm deaths account for only 2% of child deaths in similar countries. Another thing to think about is that the US is the only country compared to the peer countries that you see here that has seen an increase in child firearm mortality over the last 20 years. Meanwhile, in similar nations, this has actually declined. And firearm deaths in the US, if we compared them to the rate that we see in Canada, our analysis has actually found that we would have roughly 26,000 fewer lives lost in the US since 2010. So again, that would be taking the rates that we see in Canada and going back to 2010. So what do we know about how we got here? When we look at trends over time in the US, we see that these rates have been increasing, especially since the pandemic began. And now these rates are nearing 4 per 100,000 children. And another factor to consider here is that the majority of these firearm-related deaths are made up of gun assault deaths and suicides by firearms. And during the pandemic, gun assault deaths have spiked, and that is what is primarily driving the increase that you're seeing here in this chart in 2020 and 2021. Now, another factor to consider here is that while gun assault deaths largely make up the firearm deaths we see, we have also found some surprising trends when it comes to firearm suicides. If you look at this figure here, the data we're showing breaks out youth suicides by firearms, which is represented by the orange line, and suicides by any other means, which is represented by the blue line. And as you see here, historically, suicides by firearm have lagged compared to suicides by other means. But in recent years, we see that suicides by firearms are increasing, whereas suicides by other means are decreasing. And by 2021, nearly half of youth suicides involved a firearm. So this further highlights questions that we have around firearm accessibility. Because what we do know is that access to a firearm, particularly access to a firearm within your home, is a risk factor for suicide. Additionally, what the research tells us is that roughly half of suicide attempts occur within 10 minutes of the current suicide thought, which again underscores the role of access to firearms. And another point to consider here is that suicides by firearms are by far the most lethal type of suicide. There are several other factors to consider when we're talking about this increase that we're seeing in firearm-related deaths. First off, firearm sales have increased during the pandemic. And as I've mentioned, at the same time, we are seeing firearm deaths increase across the country. The second thing is that there are many limitations when it comes to firearm data. Accessing this data can be challenging. For example, we don't have much information on non-fatal firearm-related injuries, especially among children. So this can prevent us, for example, from understanding how broad of an impact gun violence really has across this population. And this brings me to my next point, which is while there are data limitations, we were able to analyze youth firearm deaths across several demographics. And what we found is that there were already some noticeable differences, for example, across race and ethnicity in firearm deaths among children. But during the pandemic, these differences have become more pronounced. And that's what we'll see in this next slide here. So what we're looking at is the breakout of firearm deaths by race and ethnicity for the period pre-pandemic, 2018 and 2019, through 2020 and 2021, the latest data available at the time of this analysis. And as we can see, prior to the pandemic, Black youth were already significantly more likely to die by firearms compared to their white peers. But these differences have been exacerbated during the pandemic. And by 2021, the rate among Black youth had reached 12 per 100,000. This is not only substantially higher than all other race and ethnic groups, but it is also 6 times higher than their white peers. Additionally, Hispanic youth also saw increases in firearm-related deaths. And while data for American Indian and Alaskan Native youth fluctuated, and as you can see, was not available for 2018, we can at least see that their rates always remained higher than their white peers. The increase in firearm deaths among youth communities of color is staggering. By 2021, although Black children made up only 14% of the youth US population, they accounted for 46% of youth firearm deaths. So this is a huge disparity. And as you can see here, they had an 80% increase in gun assault deaths pre-pandemic to 2021. And Hispanic youth had nearly a 50% increase in gun assault deaths during the same time period. And in terms of suicides by firearm, historically, these have always been highest among the white youth population, but we have also seen sharp, fast increases among Black and Hispanic youth when we look at data prior to the pandemic compared to 2021. So as you see here, Black youth had nearly an 80% increase in suicide by firearms, and Hispanic youth had nearly a 50% increase. And I also want to point out here, which I will touch on more later in the presentation, is that there has been an increased attention around mental health and suicide prevention efforts, particularly for Black youth, as evidenced by these increases that we're seeing in suicides among this population. Some of our other research has also found that children of color are more likely to be exposed to gun violence than their white peers. We have also found that areas with a high concentration of poverty are more likely to experience firearm-related deaths. And as we know, poverty disproportionately affects children of color. So similar to race and ethnicity, we also see large differences in firearm death rates by sex. So as you see in this figure, once again, we're tracking the data from 2018, prior to the pandemic, through 2021. And we see that the firearm death rate among male youth has always been higher than female youth, but this difference again was exacerbated during the pandemic. So as we can see, female youth rates have stayed relatively stable, whereas male youth rates have increased by about 50% during this time period. So for this next portion of my presentation, I'm going to focus more on the mental health impacts of gun violence. And as I move through these next slides, I encourage you to think about a few things. The first being that children are exposed to firearms in a number of ways. For example, this could be through domestic violence, interfamily conflict, firearms stored in the home, neighborhood and school violence, including school shootings. And these exposures can negatively affect children and could lead to long-term trauma. And we know that childhood trauma can have lasting impacts. It can be linked to poor mental health and substance use issues later in life. The second thing is that it's difficult to quantify the share of survivors of gun violence and how many children witness gun violence. So even if they are not physically harmed by gun violence, just the exposure to, say, family gun violence or school violence, that's something that's very difficult to quantify. But regardless, we know that the research shows there are many ways this can negatively impact children's mental health and well-being. So as we see here, the exposure to gun violence can lead to post-traumatic stress disorder and anxiety, among other mental health concerns for children. Some research has also shown that survivors of gun violence have an increased risk of developing substance use disorders. And gun violence also affects children in terms of school performance. Some research has shown that children are affected with increased absenteeism and a lack of concentration while they are at school. And as I mentioned earlier, access to a firearm, particularly a firearm in the home, is a risk factor for suicide. Now, in this next slide, I want to talk a bit about mass shootings, including school shootings. While they receive increased coverage, they actually only account for a small amount of firearm deaths. However, mass shootings can negatively affect children and the broader community's mental health. Some research on mass shootings finds that even knowledge of mass shootings, as opposed to direct exposure to the event, can be linked to increased fear and anxiety. There are also several studies that have gone and examined communities that have had direct exposure to school shootings, and they have found that youth in those communities are more likely to have antidepressant use and an elevated risk of suicide. Additionally, there's been a lot of implementation of active shooter drills. Nearly all schools have some type of active shooter drill, though there's a lot of variation in how these are actually carried out. Some of these drills can be very intense. They may be so real that they involve real weapons. They involve theatrical makeup and ask for sometimes even students and staff to be volunteers. And sometimes staff and students have been deceived into thinking that this is an actual school shooting event. And there have been some concerns around the lack of research on efficacy of these active shooter drills. These are really a very new thing. And recently, the American Academy of Pediatrics issued some recommendations that the intensity of these drills is harmful to children. And so the drills should not be this intense. And also suggested that children be removed from the practice of these active shooter drills. I also want to highlight some of our findings on gun violence at the broader population level, because as we know, gun violence can affect families and communities at large. In one of our analyses, we looked specifically at suicide rates at the state level. And what we found is that suicides by firearms, which are shown in orange here, vary greatly across states. Meanwhile, suicides by other means are relatively stable across states. Further, we looked at the number of firearm provisions by state and found that there was a lot of variation. So, for example, the state with the lowest amount of gun law provisions was Idaho, and they had one provision. And the state with the most amount of gun provisions was California, with around 111 provisions. So now if we look at the chart, we can see that California has a far less degree of a far smaller rate of suicide by firearms, whereas Idaho has a much higher rate of suicide by firearms. And again, Idaho only has one gun law provision. So overall, in this analysis, we found that states with fewer gun laws had more suicides by firearm compared to their counterparts. And as a reminder, rates of suicide by other means were relatively stable. So collectively, what this suggests is that other types of suicides are not more likely in states where access to firearms is harder. And this really underscores the idea of what the role of access to firearms can play in suicide and mental health. So given this information and the current climate, there are a lot of things to think about going forward. First, we know that there is increased attention around children's mental health in light of the pandemic and rising gun violence, including school shootings. There have been a number of recent federal laws put in place that aim to address student mental health needs. For example, in the American Rescue Act, and for example, for gun reform in the Safer Communities Act. And some things to consider here are, how are the funds through these provisions being utilized at the local levels? We know that there is a lot of emphasis on prevention efforts, providing crisis support, and building out the workforce of mental health providers. So I think one of the questions to consider is, how are these funds being used? Are schools and school districts, are they able to use these funds towards actually recruiting more mental health providers? Are there any other challenges associated with that? For example, we know that there has been a lot of attention around mental health workforce shortages. So even if schools have the funds, are they able to recruit these providers? Are they looking at other methods of introducing mental health support in the school, perhaps through telehealth? Some early data does suggest from the American Rescue Plan funds that schools are trying to use a portion of their funds towards securing more mental health providers. We also know through these recent provisions that Medicaid has been called on to expand their support for school-based mental health services as well. And we know that Medicaid programs vary from state to state. So it's worth looking into what is happening at each state level. Has guidance from Medicaid increased? Are Medicaid programs working with local education agencies and schools specifically to simplify and streamline the process of getting mental health support to students in need? Another thing that we just saw in recent provisions is continued investment in Project Aware, which is designed to provide support to students and especially designed to provide trauma-based support. So questions remain as to how is this rollout happening? How many schools are actually benefiting from funding for Project Aware? And then, as I mentioned earlier, there have been a lot of efforts around suicide and crisis prevention. For example, including the rollout of 988. So it would be interesting to see that with the launch that happened in July of last year, where are states now in terms of being able to handle, for example, increased call volume, and what are some of the outcomes that we're seeing with this rollout of 988? And as I mentioned earlier, there have been heightened concerns around Black youth mental health and suicides in light of the increase that has been seen in these suicides. And in response, the Department of Health and Human Services had provided some funding to promote Black youth mental health. And beginning in fall 2022, certain projects were supposed to be rolled out to address Black youth mental health. And these projects were supposed to initiate in the states of Arizona, California, Georgia, Louisiana, Minnesota, Nevada, Ohio, and Rhode Island. So it would be interesting to see what is happening in these states, some more details on this rollout. Is it focused on providing support within schools or at the community level, et cetera? And one more thing that I wanted to add is when we talk about linking youth into support services so that they can receive more mental health care if needed, they can receive more trauma support, especially if there's a history of school shootings in their community. Another thing to think about is what is the makeup of the providers that they're seeing? Are their providers trained in culturally competent mental health services? This has become a bigger and bigger issue over time. And although we don't have access to a lot of data on provider makeup, what we do know is that in 2015, there was a study that showed that although the Hispanic and Black population made up about 30% of the population, they only made up 9% of the psychology workforce, which shows the kind of highlights the issues around whether or not people in need are able to actually access culturally competent care if there's a lack of a diverse workforce. And that concludes my presentation. For more information, I've linked to a couple of resources on our KFF website. And we also have a number of publications that you can access through our mental health tag that covers issues related to mental health and substance use disorder for children and adolescents in particular.
Thanks, Nirmita, for being here. I'm Maria Garnolata with W9J News. Regarding, your last piece on mental health providers, what's your take on the use of translation services in places where they don't have, they say, oh, we don't have folks that speak Spanish, so they're using a translation service. What's your take on that? I know it's very specific, but I figured I'd ask, see what you think.
No, I think that's a great question. Unfortunately, I don't think that we have seen much of that in our research yet. I know that anecdotally, we have heard more about translation services being offered and also trying to link people into care with providers that may be able to offer services in specific languages through telehealth if, for example, they're not available for in-person care. But that's a great question. Unfortunately, we don't have much information on that.
I'm going to jump in. This is Adam Eckelman with the Modesto Bee in California. Thank you again. I had two unrelated questions. The first, you talked about mental health funds from the federal government, and you mentioned Project Aware. And you gave some great suggestions. Are all of the funds that you mentioned coming through that federal program, Project Aware, or are there any other federal sources we should be looking at for mental health funds?
There are also other federal sources. There are individual grants, school-based training grants that states can apply for. And that was in provisions for the Safer Communities Act. Another place to look would also be Medicaid funds. And I know that, I think you said that you are from California. Medi-Cal has been running some new, or at least they're trying to run some new programs to incentivize mental health providers to provide care in schools. So I think it would be an interesting place to see what is happening with your state Medicaid program.
I have a question, Nirmita. I recently saw a story about suicide among Black girls, teenage girls, rising dramatically. And so hearing this presentation this morning has me wondering, I know the numbers wouldn't necessarily show this, but is there a connection to the past few years of the so-called racial reckoning, particularly for young Black males? Is there a connection between the rates of hopelessness or mental health challenges connected to that time period? And then COVID on top of everything else.
Right. I mean, there's a number of factors that we've seen that could be contributing. It's also sort of difficult to isolate these issues, especially when we're looking at youth populations. Because, for example, even surveying youth can be a more challenging project sort of to take on, but there are a lot of studies in the past that have shown that even at times when the data is showing that mental illness may be rates of mental illness may be similar across different race and ethnic groups, it probably is not taking into consideration that communities of color may face different obstacles in being as forthcoming with their mental health challenges. And this may be due to, as I mentioned before, lack of culturally competent care, may also be due to stigmas within their own community, in sort of sharing about their mental health concerns. But all this to say that there are a number of factors that could be contributing to this rise that we're seeing in Black youth suicide. And that ranges from the pandemic, racial tensions, gun violence, and perhaps even more issues that children are facing, having been in the home more during the pandemic, and also facing family financial insecurity.
Hi, I'm Hiba Ansari with Sahan Journal. I have kind of a similar question. Do you have observations or even recommendations for studies that show the specific mental health impact of children who live in communities where there was a high-profile police shooting, and then subsequently protests and unrest in their neighborhoods, how that impacts them? So, for example, kids in Minneapolis or Ferguson. Do you have recommendations for where we can learn more about that?
That's a great question. I know that there is a health affairs article that I'm thinking of that has linked to several peer-reviewed journals that I'm not sure if they have isolated looking at places where there have been high-profile police shootings, but I know that they have looked at some high-profile school and other mass shootings, so that might be helpful for you. And I'm not sure if my screen is still up, but if you would like to, you can email me and I can share those with you.
Question here.
Yeah, hello. This is Henry Gass with the Christian Science Monitor. You mentioned links with poverty around rates of firearm deaths. Do you have breakdowns in terms of rural versus urban and suburban? And those sort of geographic breakdowns?
I don't think we were. I'm sorry.
Yeah, I mean, sorry, you said it sounds like you don't, but I'm also wondering if there's a factor there with healthcare access in rural areas as well.
Yes. So to your first point, I don't think that we were able to break that data down geographically specifically for the youth population. But as a side note, I would say that in another analysis we did, we were able to look at suicides overall for this population, and we could see that suicides are growing in rural areas compared to more metropolitan areas. And then to your second point, there are a lot of issues with access to care issues in rural areas versus more metropolitan areas. In light of the public health emergency, there were a lot of restrictions lifted around the delivery of behavioral health services through telehealth. So we know that kind of helped to alleviate some of these access issues and introduce perhaps in areas that previously were not able to access care as easily. They could now through telehealth services. And I also just want to note there that I spoke about school-based health services, school-based mental health services. And even prior to the pandemic, there were a number of schools that were located in rural areas, and they were utilizing telehealth as a means to provide services, including behavioral health services, to students in these rural populations.
Hi, this is Anna Bowman from the Houston Chronicle. You mentioned that there's limitations on data surrounding certain elements of gun violence, especially non-fatal shootings. I'm wondering if you could talk a little bit more about why that is, and then second of all, if you have any tips for journalists on accessing that information and pushing for the release of those numbers.
Sure. Well, in the past, there were some federal freezes around gun-related data, which particularly affected some organizations such as the CDC. I believe that in recent years, some of these federal freezes were sort of reversed, and that several recent federal budgets have actually allowed for some funding to expand data collection and research around gun violence. I would say that at this point, I haven't really seen the effects of that yet, but my assumption would be that we may have more data soon. Another thing is that while in terms of looking for data, there is, you can access firearm death data through the CDC. But when you start to look at non-fatal injuries, that's where it becomes a little bit more complicated. Sometimes it depends on how states themselves are tracking this data. And in our case, when we look at even death rate or non-fatal injury data, there may be some limitations as you look at smaller and smaller groups. For example, looking at youth populations versus looking at the entire US population, regardless of age.
I had a question about, I think one of the most interesting things I took from the presentation was this estimate of the window of time between the time a young person considers suicide and actually does something about it. And I believe, if I heard you right, you said the presence of a gun in the home heightens that risk. Is there more for journalists to do? Or if I got it wrong, let me know. But I just wonder if, without us attempting to be advocates or whatever, does the research show that your kid may have a greater chance of doing that if there's a gun in the house?
Yes, so these are two sort of different analyses that we looked at. And one of them, which I think we have seen sort of across the board, is that having access to a firearm in the home does increase the risk of suicide. And then we have also seen some more recent studies that show that I think it was about half of suicide attempts occur within 10 minutes of the current suicide thought, regardless of the means, the method of the suicide. In terms of what I think journalists could look at, I would suggest that there have been there's been increased attention around these crisis services and support for people experiencing suicidal thoughts. And we can really see that not only with the rollout of 988, but also with the upping of sort of trying to deliver prevention services to schools and implementing Project Aware in more schools to provide trauma-based support. So I think it would be interesting to look at what is happening at the state level. How has the rollout of 988, for example, how has that been going? Are states adequately prepared to handle the uptake in volume? And who is answering the phone in these crisis services? What is their background? And are there any shortfalls with what we're seeing in these different rollouts, for example, with 988 or trying to strengthen school-based services?
Hi, this is Henry Gass again with the Monitor. You mentioned the low numbers of Black and Hispanic psychologists, I suppose, people in the psychology space. Are you aware of any like initiatives or efforts addressing that specifically? To like increase those numbers?
Yes, I think there have been efforts to try and diversify the workforce. I'm not too familiar with how that's necessarily working at the state level, but I know that nationally there have been some pushes to help diversify the workforce. I would also think it's interesting to maybe even just look at, for example, maybe if a state record is available, to see what the graduating class of psychiatrists from med school, what the racial and ethnic makeup is, because another thing we know is that a lot of areas don't even meet the ratio for psychiatrists to population ratios.
Here's another example of why I wish I was a journalist or day-to-day journalist, because I would love to profile a young person in grad school or medical school for psychiatry, psychology, and who's doing it specifically because of the lack of providers. Because even though there have been tons of stories done on the cultural gaps and how ethnic communities sometimes resist mental health treatment, I just think there's not too much that can be done to get that message across and to perhaps influence and help someone else see the need or the capacity. Any other questions, Maria?
Hi, this is Maria Garnolata with WNIJ. Hola. How do you find that reporters are, writing about, reporting on suicide, and whether what's helpful, what's not helpful about how folks even write about suicide?
Mm-hmm. Sorry, I'm just taking a minute to think that through. I think I don't know how much I can speak to what has been previously reported on suicide, but I think some things that would be really helpful to know going forward is what different services are available in states. One of the most surprising findings that we found in the analysis that I highlighted that was looking at suicide by method, by state, and the number of gun law provisions was knowing that, okay, what we're seeing here is the fewer the gun law provisions, the higher the suicide by firearm rate. So I think it would be more interesting to know going forward what is happening at these different state levels, because what we see is that for 988 and other crisis services, there's really a lot of opportunity for states to sort of take on their own way of handling the crisis within their state. So it would be interesting to know more of like what's happening at these local levels.
I'm going to ask, unless there are any other, Megan?
Megan Mangrum with the Dallas Morning News. Are you aware of any research that looks at the effectiveness of like gun safety programs within schools? I know that more and more we're seeing school districts kind of like just having programs sending information to parents. I know of a school district in Tennessee that actually was helping parents purchase like gun safes or like gun locks and talking about access in home. Is there any research around that?
I think that I might know of some research that looks at the involvement of a couple of things. One being further training for pediatricians to be able to sort of screen parents, to ask about guns in the home, and then how they can appropriately talk to them about safe storage. And I think that I may know of one other study that also looks at sort of school-wide prevention efforts that also involve things like an increased focus on social emotional learning, and also involving parents into the mental health services that schools offer, meaning that services may not just be one-to-one school counselor to student, but also bringing the families in. I'm happy to share those with you again if you have my email, or I can, I'm just not sure if my screen is still up, but please feel free to email me.
That's actually another good story idea. I can't remember if I included this in your reading, advanced reading, but did you see a link about the pediatrician in Uvalde? Did I include that? Okay, I'll get that to you after this. But Roy Guerrero, I think is his name, and 5 of his patients were killed in Uvalde. And so he's received some high-profile coverage from CNN, Men's Health, et cetera. But I think this issue of pediatricians needing to do more than just treat physical health. So if any of you are in a community or where this happens or whatever, that's also another story. But I'm going to take once again, the moderator's privilege and ask you the last question, Nirmita, and that is, we all saw the story about the 6-year-old who took the gun to school. And those stories always, of course, get the headlines. And they're headlines not only around the country, but around the world to show how violent and scary things are in America. And even though it's true, if you had to advise a journalist about how to write a contextual follow-up story on why this happened, what may have failed in the family or whatever, do you have any advice on how we can, as people who aren't necessarily the cop reporter or the person who rushes to the scene to cover these incidents, do you have any advice for how we can produce contextual stories about this issue?
I think that, forgive me for using the word opportunity, because I know that this is a very difficult subject, talking about a 6-year-old. But one thing that came to mind for me with the research that we're doing is, as I've stated, and again, not to take away from mass shootings in any way, is that after all, mass shootings make up a very small portion of all gun-related deaths that are occurring in the States. And I think there is less coverage about the fact that children are being exposed to guns in their homes, in their neighborhoods, through domestic violence and these other things. So I think that seeing some more reporting about what is happening to these children outside of the school setting. Like, are there are there more incidences of domestic violence, et cetera, that are resulting in firearm-related injuries or deaths, and then sort of using the data that we are able to provide to show that, these are the trends we're seeing over time. These are some of the demographics that we're seeing that are more affected over time, using that data to kind of help bring light to what is happening, not just, obviously at the school, but deep within these communities.
Great. Well, you've given us so much to think about this morning as we prepare to go back to our newspapers, our organizations, and start preparing content. So I want to take this opportunity to thank you, Nirmita Panchal, for joining us this morning, and we will definitely stay in touch with you. Thank you so much.
Thank you so much. Thank you.